So we're going to go, this is going to be a real brief overview. And actually, before we start everything, I just want to thank you guys for coming out tonight. This has been a tremendous response. I really appreciate the fact that you guys take time out of your busy schedule. I know it's a Saturday, I know you guys have families and everything. The fact that you guys show this much concern about the management and care of your animals speaks just so much about you guys. Thank you very, very much. This is a tremendous amount of fun for me. I really enjoy getting to know you guys. As a side note, when I was in California before I moved to Oregon, I did a lot of work with dairy and beef. I did a fair amount of work for small ruminants, but things were going corporate, and it was getting big, and I was disconnecting from the producers because the producers were now a company instead of a family. And so I came up here, and with the beginnings of the local board movement that started here, and the beginnings of the people being more interested in trying to connect with their food sources, and this whole idea that's been growing, and I've had so much fun getting back into this whole thing, getting to know you guys personally, knowing that, you know, it's great to go out to a farm and deal with an animal that isn't number 97, it's Barbara. You know? And so it's been a hey, Shelby's here. Hey, so it's been a great experience for me, and just this is just getting bigger. This swell is just getting bigger and bigger and bigger. So I salute you guys. You guys are awesome. So thank you.
Thank you, Jeff.
Real quick biology. I understand that a lot of this stuff is redundant to you guys, and hell, some of the people in this room, believe me, know more about this stuff than I do. So when it comes to small ruminants, though, you know, sheep and goats, obviously we know they're fairly similar, so there's some generalities. Gestation, roughly 150 days. This can be from anywhere from 149 to 151. Everybody also knows that every animals are themselves are very singular. They can go 142, 144, 145. On the average, most animals are consistent within themselves. Like the same doe or ewe will tend to lamb a kid at roughly the same time every year. However, we do have herd averages. So, what does it mean for lambing and kidding? Well, let's start with what does labor mean? Labor is softening of the sacrotuberous ligament, and it usually starts and ends within an approximate 12-hour period of time. That's, again, an average. So when we talk about this stuff, stage 1 labor, when everybody talks about an animal in labor or a person in labor, that is typically stage 2. We'll get to that in a minute. Stage 1 is when the lambs or kids are in the uterus and they need to be repositioned, getting ready for delivery. Up until that point, they're just sitting in a nice little warm bath, and now it's time to introduce you to the cold, cruel new world. And so they got to do this. Well, the uterus, being a big ball of muscle, that's what does it. So the uterus is starting to contract in rhythmic and very smooth manner in order to get these kids and lambs moved up towards the cervix. Well, I don't have a uterus, so I can only imagine what that would feel like. Clearly, it doesn't feel very good. So this is typically silent insofar as you don't really see a lot of overt behavior. What you normally see at most is an animal that maybe goes off feed a little bit, starts acting a little bit quieter, maybe even separates itself from the herd, frequent urination, that kind of thing. Again, smaller herds like you guys have, I'm sure you can zero in on these things like, whoa, she's acting funny. And you know, that's one of the great things about this stuff, and you guys know right away, like, oh, this one's, you know, something's going on. So that typically lasts, you know, anywhere from 1 to 12 hours. Sometimes it's incredibly silent, you know, insofar as the goat or the ewe will show you nothing. And then all of a sudden, bam, they're in labor. Labor, stage 2 labor is what we call active labor. And what this is active labor. If you can understand what active labor is, it actually helps you understand the problems that can go with when labor doesn't go well. When the first fetus moves up into position, and this is typically going to be, on average, both front feet coming forward and the head's coming right behind it, assuming there's just one in there. I mean, one in the canal. When the cervix, as you know, is along the tube, when they get close to the internal part of that tube, and the cervix is starting to dilate. As they move into the cervix, that sends a signal to the brain that says it is time. And the cervix completely dilates. The doe or the ewe will then start to contract, actively using her abdominal muscles and push that first one out. Okay, so what happens is that is active. That's active. The average time runs anywhere from probably 15 minutes to 30 minutes per kid or lamb. First timers obviously will take a little bit longer because they've never been through it before, and they'll get up, turn around, try to figure out what in the world's going on back there. You know, the old experienced girls, they just kind of sit there and go, oh God, here we go again. Boom. You know, so and stage 2 labor is over when the last kid or lamb hits the ground. Stage 3 is the involution of the uterus and the expulsion of the placenta. Again, that can take a fair amount of time. I do get phone calls every single year regarding, hey, it's been 12 hours and the placenta is still not out. These are typically not big emergencies. I'm glad you guys are concerned about it. I really don't get excited until it's actually been in about 48 hours. Whether you put them on antibiotics, I kind of leave that up to the owner. I'm a little more concerned about, like, why is the doe or the ewe retaining? Are we talking about a calcium issue or a metabolic issue? Because this should be over pretty quick. So, I mean, when it comes to retained placentas, you guys can just, there's a few things that you can do. Usually the best thing you can do is get the kids or the lamb to nursing, and for whatever reason it's not possible, like a stillborn or something like that, do the milking yourself, stimulate the mammary gland. The mammary gland, the idea about the way Mother Nature did this, you stimulate the mammary gland, it sends a signal to the brain, lets out natural oxytocin, that hits the system, causes milk letdown, and the kids can nurse. It's a nice little cycle. One of the things that also happens is for approximately 72 hours after delivery, the uterus is very sensitive to oxytocin. So as the lambs and kids nurse, the oxytocin is also causing uterine contractions, uterine involution, out goes the placenta, out goes everything, it cleans out the uterus, and everybody's happy. So one of the reasons why sometimes retained placentas occur is because the kids or lambs are not nursing very well. So that's one of the first questions I will ask, as many of you know, is you call me and say, are they nursing? And yes or no, are they nursing? And because that will tell you a lot. So anyway, so as we know, post-kidding, the does, sometimes I like does, sometimes I like ewes. Sorry about that. Post-kidding, the mom cleans the babies off, the vocalize, try and get them nursed. Nursing generally occurs within 30 minutes. If it occurs anything later than probably an hour, sometimes it just kind of depends. If they're not up and actively nursing in about an hour, you have a problem, and you're going to have to step in and help. And that generally requires stripping them out, tube feeding them, whatever it is that you like to do. Every farm has their own technique. So when it comes to managing this stuff, one of the best things you can do is just keep good records, because I understand it's hard. I don't even know my own user or lamb, to be honest, because I just run them with a ram. But if you have, those of you who are doing AI or under a transfer or something like that, you're doing a very controlled situation, knowing when they got bred makes all the difference in the world, because if you know for a fact she's supposed to lamb next week Sunday, and she's going into labor now, you know that's a problem. Whereas if she's going into labor and you're like, I don't know when she's. So clearly, right there, just answers a lot of questions. So good record keeping is a great management tool. So other thing is to make sure the doe is taken care of. So when they're pregnant, first 4 months, first 4 out of the 5 months, you basically feed them as any other animal in the herd. And the last month is kind of the critical time phase, and a lot of people know this. 70% of all fetal growth takes place in the last month. It's amazing. It's one of the tricks that Mother Nature played on these guys. It's cruel, but you have an expanding uterus, expanding fluid, which is causing, obviously, it's a very finite space. It's causing the stomach to shrink down because there's just not enough room in there, and yet all the growth is happening at that point. So what ends up happening is you tend to need a lot more protein and a lot more energy and calcium during that time. Again, it also depends on what's going on. Alfalfa is good. There was a couple of years ago, peas were a little hot around here. Everybody was eating peas. That was good. It was very good protein. Is anybody eating peas anymore? What? Okay. So, excellent protein source, but it seemed like it was the rage for a while. Not many people are using it anymore. Alfalfa is always, it's always there. Alfalfa's our kind of go-to. You can use soybeans and stuff like that. It just kind of depends on what's available and how much you want to use. Parasite issues, this was written a couple of years ago. Parasite resistance is becoming its own thing. A lot of you heard me harp on this. We're trying to get away from injectables. We definitely don't want to use porons. We're going more to recommending just orals, and at the same point, we're actually strongly recommending fecals being done. That's a whole other topic in and of itself. And I don't know if we'll get into it tonight, but we'll see. Selenium is obviously an issue. On the next page, this stuff's kind of pretty straightforward. Kid health, taking care of the kid, the navel, the nutrition. So I just want to kind of skip down to potential problems here. Pregnancy toxemia. Just out of curious, show of hands, who has goats? Okay, and who has sheep? Okay. Just from phone calls and visits, I seem to have had a lot of problems with news with pregnancy toxemia this year. Would you guys kind of agree with that, or would you say this is an average year or a bad year? It seems like it's been a bad year. Okay, so I'll say basically. So pregnancy toxemia, it is more of a problem in sheep than goats. A massive drain, massive energy drain, and it's just, to get on top of it, we generally just try to keep them going. What it boils down to, you have to try and reverse the catabolic state that's happening. So we try to pump them full of calcium, sugar if you have to, and also propylene glycol is one of the key components. Vitamin B and thiamine are very, very effective in these things, especially in the goats. The reason being is thiamine, the decrease in thiamine causes polioencephalomalacia. You guys all familiar with that? Okay, so polio, what it is thiamine is B1. There's three main Bs that we like to use. B1 is thiamine, B6 is niacin, B12 is cobalt. Sorry, the ball, whatever you want to call it. So what it is the rumen microbes produce these B vitamins that are absorbed directly out of the rumen into the bloodstream. B1, thiamine, is used in a lot of different processes right away, including a lot of metabolic processes within the brain. When they go off feed, when they're having metabolic stress, especially in the goats, not so much in the sheep, but especially in the goats, and sheep too, so we have to treat it. As thiamine levels drop, the gray matter of the brain starts to become soft. Polioencephalomalacia literally means, according to its Latin, whatever it is, softening of the gray matter. And as the animals become more depressed, literally, the gray matter inside the brain will turn to jelly. It's bizarre. Okay, and obviously you're talking about brain damage. Not too many animals can live with brain damage. So this is a condition that once it starts, we really got to get on top of it. The way to get around that is to pump them full of B vitamins, specifically thiamine. Now, most of the B complex, the super B complexes you will find on the market don't have enough thiamine in them in a high enough concentration that if you give it according to the label dose, you'll be able to battle polio. So, as many of you also know, I like everybody to keep a bottle of thiamine as well as a bottle of super B complex on their property and mix them together in the same syringe and give them in these situations, because polio is reversible, but at a certain point it will become irreversible. And an animal will literally become depressed, and then you could pump it full of propylene glycol, you can pump it full of calcium, you can do all these things. If it doesn't get enough thiamine, it may just completely just go over and it'll just die.
Is that 1 cc per 100?
Well, what it is, the thing is thiamine comes in this commercial product. It comes in two concentrations. One's 200 mg per mil, one's 500 mg per mil. I prefer the 500 mg per mil, which you can get less. So at 500 mg per mil, it's 1 cc per 50 pounds, twice a day. So at the 200, it would be 2.5 cc's per 50 pounds. So, and as many of you guys have seen, I think I've saved literally more goats using thiamine and blackberries than any other medicine. I mean, when goats finally get down and they're untended and they are just completely depressed, thiamine and they'll eat blackberries or they won't eat anything else. I mean, I just keep pumping these guys full of thiamine and they eat blackberries and within 48 hours they're standing again. it's pretty incredible. I'd like to take credit for it, but it's just by it's what it is. So anyway, keeping them well fed and balanced, which of course is with nutrition, is one of the things that Shelby is excellent at. Yeah.
So what was the dose on the 500?
The 500 mg per mil is 1 cc per 50 pounds. I am twice a day until the animal's eating well. Yeah.
Is that prescription only?
Yeah, it is, but I just leave it out. It's one of those things, it's kind of like the selenium thing where 3 years ago, the FDA decided you guys aren't trustworthy, so you gotta get selenium through a veterinarian. I'm like, I don't know who the hell came up with that. So just call me, I can get you a bottle, no big deal. So, okay, hypocalcemia, again, big problem. I guess that's more of a problem in goats. Why? Because goats are lactating more than, and we use more for them, so therefore we're draining the mammary gland, calcium is moving out of the bloodstream and into the mammary gland. So hypocalcemia, also known as milk fever. As many of you know, that's a complete misnomer because when they come out with milk fever, they're not having a fever, they're hypothermic. A lot of times, if you take the temperature, the two hallmark signs as far as clinical is you take a rectal temperature, it's about 2 degrees lower than it should be, and their ears are cold. The reason is because peripheral circulation is shut down, and therefore, especially if you have like Nubians, it's great. You know, if you have a big ear, you grab hold of that thing and it just feels ice cold. And so, the larger the mammary gland, the more susceptible they are. So, milk fever is actually something you don't see very often in first-time kidders and lambs. Especially older does who are milking a lot, that have big glands, they are more susceptible. Same thing happens in cattle too. And so it's just because it's a physical function of the ability to drain the blood of calcium. And so calcium metabolism is also linked to, it's a vitamin D, parathyroid hormone, calcitonin, kidney interaction with the skeleton. It's pretty complex. And so if the body's not primed and ready for it and ready for this, ready for lactation, then they are more susceptible. Luckily, we don't necessarily see the crashes like we do in cattle. Cattle are pretty amazing. As a side note, an adult dairy cow can drain its entire blood of calcium twice in a 24-hour period of time. Because the Holsteins are just, they're amazing. And so with that kind of rapid pull, you have to counter, and there's only one spot. There's only, the dietary calcium makes up a very small percentage of what the animals use as their calcium sources for milk. It's the skeleton. They leach calcium out of the skeleton. So they have to kind of be ready for this. If you rely only on calcium from the diet, you're not going to supply enough, or the ewe is going to have problems. Now, like I said, as a result, it's not as bad. We don't see the crashes that we do with cattle. So CMPK, that stands for calcium, magnesium, phosphorus, and potassium. This can come as a gel. It comes as an IV solution, which you can give orally. It actually does come as an oral solution. Calcium or gluconate is just strictly calcium and sugar. You can give that sub-Q. The CMPK, it's a little hard on them if you give them sub-Q. I don't like doing it. The reason also Caldex and CMPK later carries a risk because of the sugar. Giving that under the skin, very highly concentrated with sugar, that stings when it goes under the skin, and it can actually lead to, it can damage the muscle. So it's okay to use, it's just you have to kind of rub it hard and hope that it doesn't have a problem. So anyway, getting into dystocia, again, once you know what normal is, you know what abnormal is. Normal typically is 2 feet coming with a head. The problems in the kidney can be due to maybe the doe or the ewe is just running out of steam for whatever reason. So they can appear wobbly on their feet, they can pant, they can bloat. The uterus then just simply gives up. It can't contract, it just gives up. She wants to kick them out, but the uterus just becomes a limp rack. And it can't do it, so that sometimes you just got to go in and take care of them. But number one cause of dystocia, as probably most of you do know, improper presentation. So you reach in there, you see her, she's pushing, she's pushing, she's pushing. You know that roughly 20 minutes, the hallmark is 20 minutes, which seems like an eternity as you're standing there. I know that. I always tell people, if you go out and you think they're having trouble, you're pretty sure they're in labor. For God's sakes, look at a watch, look at a clock. Because you will sit there and go, it's gotta be 20 minutes. You look at the clock, it's 3. I mean, it's just, do not figure on here, because once you're in that charge situation, you will, time stand still. So, and the idea is that within 15 to 20 minutes, you should see progress. By progress, meaning that she's pushing, and in 15 to 20 minutes, if you don't see a foot or head or something like that, then you gotta go in and help. So, within 15 to 20 minutes, there should be progress. And so, normal, head and one or both front legs coming out at the same time. Abnormal, size, number, and pressure. By that, I mean size. Singles. You got one in there, it's getting all of mom's energy. It has this huge flat that's, grown up in. This is great. Now the big animal's got to come through a surface that's that big. It's not. So singles are probably not only that, singles are the most common reason I do C-sections. It's just because if you reach in there, I feel a head, and I'm like, no. Yeah. And so that's it. Just we have a number. That means that instead of one coming through, 2 of them are coming through, and those are what I call the jigsaw puzzle. And I understand sometimes it just takes a while. I've seen it. I've seen tons of them where you've got 2 front legs and a head, and you've been pulling. You cannot figure out why this thing's not coming. It's because once we figure it out, that head belongs to one of those front legs, and the other front leg belongs to his buddy in the back. And you've been trying to pull 2 of them through at the same time. Yeah. And so the easiest thing you can do is take a deep breath, and what you want to do is go in there, close your eyes. Just close your eyes and trace the animal. Start at the nose. Go down the neck, feel the shoulder, come down the side, find that leg. Do it the same on the other side. Because what ends up happening is you do that, you come down and go, where'd the leg go? And you'll figure out the problem. So just, you gotta take, and I understand it. You're panicky, it's hard, I know it's tough to be there. You just gotta take a deep breath and try and trace the legs. The other thing is some people, one also the most common problems is you don't realize that all the legs are, maybe all the legs that are there do belong to the same animal, but you got the wrong legs. Front, back, all right. Very easy system for trying to figure it out is you go to the foot, you go to the first joint, the fetlock, and bend it, okay? You go to the joint after that. If it bends in the same direction, you got a front leg. If they bend in opposite direction, you got a back leg. So that's a really easy way, and again, very, very common way for things that, because you'll have it, it's kind of hard to imagine, but you can have a kid coming at you like this, all right? And what they're doing is they're coming out like this. And so you got 2 feet and a head, and you're trying to pull this thing out, and you can't. And it's just, you just can't figure it out. Why? It's because you got one of the back legs. So, okay, breach, again. Another very, very common way of happening. These also can be pretty tough because what can happen is if you have a large kid or a large lamb, as I said before, if you think about it, the feet are coming through the cervix, and so is the head, and that's starting. If you have a true breech birth, which is it's coming butt first, and the back legs are going forward, all you got is a tip. If you think about holding a lamb or a kid up, you got a section of body about that big. And now it's got to try and again fit through the cervix. So the thing that happens is you got this large butt and a small cervix, and it's doing this. And what that does is if the legs are supposed to come through and stimulate stage 2 labor, that one's not. So what you'll frequently see with true breech births is they walk around and they push and they stop. Push and they stop because they're not quite getting fully into stage 2. And again, people call me and say, this is what's happening. That's the first thing that jumps into my mind. You got a breech. It's because she's trying to get into stage 2, but because the fetus is coming in the wrong position, you can't.
Is it common for them to even not even go into
Yes.
stage 2?
Yeah. They'll go through stage 1, and especially probably that, and also sideways. When they're coming sideways, they don't even go into stage 2. because there's no trigger. There's it's supposed to be the entrance through the cervix, the internal os of the cervix is going to trigger this, and then doesn't get triggered. So if you do come up with a breach, the way to handle a breach is it's pretty straightforward. If you just reach in there, grab a back leg and pull it, depending on the size of the fetus, you could potentially rip the uterine wall, and that's obviously not good. So what you want to do is, you're reaching in there, now they're pushing against you, and of course it offers a lot of pressure. But what you want to do is you reach in and grab the hock of one of the legs, whichever one's most available to you. And the way I tell people is take the point of that hock and try and put it in the ass of the baby. Okay, that obviously won't work. But what that does is as you rock the leg up, it pushes the fetus forward and down. And then if it's the right, and then what you're going to do is you're going to take the hock and move it to the outside, meaning if the doe or the ewe is going that way, and I got them right here, and push that hock up, and it's the right hind leg, I'm going to cock it to the outside, and at the same time use my pinky or something and swing that leg. The foot goes to the inside, the hock goes to the outside. If it's the left, it goes that way. If it's the right, it goes that way. And what that does is by pushing forward, you're buying yourself some space. By putting the hock over to the side, you're now allowing the leg to be angled, and the foot can sweep, and you can get it out. Okay? And then you do the exact same thing for the other one. And the last thing you want to do is make sure the tail is down, because if the tail's up, it acts like a parking brake. So pull the tail down, and then just pull the whole thing out.
What if the tail's out first?
Again, here's the other thing. Now, you guys, probably a few of you have seen me try this, where if the tail's out first and that thing's halfway out, sometimes I just lube it up and give it a yank. Because the thing is, if the tail's coming all the way out, if it's already out of the vulva, you're halfway there. Sometimes it's a little bit, those are judgment calls.
Yeah.
You make a call, you can doubt yourself later, but yeah, it just kind of depends on how much room you got. So again, and first singles, mismatch. So these are just the guidelines. Stage 1 labor, 2 to 12 hours. If they're not progressing, that's always a tough one to assess because sometimes you can't see them. Stage 2, no progression within 30 minutes. Basically, that means they are straining, they are pushing, but nothing is happening. Yeah, again, look at your watch, give you 15 or 30 minutes. The older the animal, the less time you give them. Anyone who's been to any goat or a sheep or an doe or ewe that's been through this 4 or 5 times, they normally sit down. And so if they're pushing and it's been 15 minutes, get in there. Or call somebody who's comfortable with it. So manipulation, if you're not comfortable, call somebody. 3 most important things to remember when it comes to dystocias is lube, lube, and lube. The slicker you get, the faster it will come out. And obviously, a kid that's pulled, depending on how long this is going on, they're going to be ones that are going to be a little more stressed. They're going to need a little bit more help, swinging, rubbing, possibly tubing. So you have to pay a little bit more attention to those guys than just ones that just kind of catch them with the catch. And then I just got last thing about the lactation. So there's that. Okay. So the emergency kit, pretty self-explanatory, and the common metabolic problems one is pretty self-explanatory. So if you guys have any questions on those, just come find me or call me or email me and I can help you. So 2012 current topics. Like I said, what these are, I'm just going to rip through these really fast. These are the things that I pulled out of the literature that I thought it'd be kind of nice for you guys to hear about. Again, so you just kind of, things that kind of make you go, So, first one, the genetic test for OPP susceptibility. OPP is ovine progressive pneumonia. It is the same virus as the CAE virus, the Caprine arthritis encephalitis virus. So when it's in sheep, it acts a certain way, and when it's in goats, it acts slightly different. So OPP and CAE are essentially the same thing. What they've done is, with all, everything's being genomed out right now, everything. What they found was on chromosome 17, there's a gene on there that seems to be closely associated with susceptibility and resistance. If you can then have an animal that's genetically resistant to the virus, of which there is no vaccine and there is no cure, that would be kind of ideal. So that's in the works right now. Obviously, if they can figure this out in OPP, the next step is going to be to figure it out for CAE. What's going to happen is, genetic markers are obviously becoming more and more common. And I don't really understand a lot of this stuff, to be perfectly frank. And all I do know, though, is that what's going to start happening is you're going to be able to send in blood or hair at certain point. And you're going to get a breakdown genetically as to what your animal is going to be potentially susceptible to and potentially resistant to. And then that'll go into your management strategies for then selecting breeds. And we're not that far away from it, but this is kind of like, one of those things. A new CL vaccine. Texas Vet Lab has been granted a conditional license. What that means, when the vaccine is conditional, it has not been shown to be effective or potent. Basically what it is conditional vaccines are a nice way of saying it doesn't kill anything and we think it works. So we're going to start testing it out into the real world, is what it boils down to. Now most of the time they're fine. There have been a lot of conditional vaccines on the market for a long time. You guys probably didn't even know they were conditional. And it just, I'm not sure they did, this one is being done by state. I didn't have enough time to find out if Oregon says it's okay or not. The whole CL topic is, again, we can talk for weeks on this. So again, I just want to let you guys know that the Texas Vet Lab vaccine is out there. So organic versus inorganic selenium supplementation. As many of you know, we are in a tremendously selenium deficient area in the Pacific Northwest. Selenium sort of steals the show with a lot of these things. My own personal feeling is we should also be looking at a lot of copper, but that's coming down. That will be coming up pretty soon anyway. So these studies were done in sheep. Basically what it boiled down to, I think a lot of you guys probably knew this already, organic selenium sources are more bioavailable than inorganic sources, to the point where you can pour a lot of dietary, if it's inorganic selenium, you can just pour it into the animals. They're only going to absorb to a certain point. It's going to be a ceiling effect. Whereas with the organic selenium, as you feed it, it's going to go up and up and up. And so there is the possibility that if you overfeed, obviously there's a toxicity issue. Likewise, the organic selenium has been shown that if you feed more of it, the does or the ewes will get more of it, and they will pass that through the placenta to the babies. So the problem that you have, though, is that when it comes to dietary related, and again, Shelby's going to be probably the person who can talk more about this. The FDA regulates supplements, so you may have to kind of go off on your own to do this. One of the things that I read in the last couple of days is the drought situations around the country is changing the profile of some of these grains and soybeans, and the selenium is going up concentrated-wise because of the drought, because of the effect it's having on the plants. Apparently there was a swine operation that had a whole bunch of deaths that were figured out that it came from selenium. They had changed the amount that they were feeding, but the amount inside the food had changed. And so they were killing the pigs without even knowing. So it's extremely difficult to measure your diet. You have to keep doing dietary tests all the time. So if you really wanted to monitor your herds or flocks, then you have to do testing on your animals, sort of on a year-to-year or whatever kind of basis that you want in order to maintain these things. So that took us, that kind of, I'm going to jump over, took me to the next one. Blood or serum for measure. A lot of people call me about this. Hey, I want to get this measured, hey, I want to get that measured. How much is it for a trace mineral profile? The take home on this is that for cobalt and copper, liver is really the best choice because blood levels are just inaccurate. Iron, manganese, molybdenum, I can understand that, and selenium, whole blood is good. So a lot of these times, getting tests done can be very difficult and they can be very expensive. I understand that, but it is the only real way of doing it. I think that I think what's going to happen is over the next few years, I'm going to start pushing people more and more to start doing copper tests on the livers for copper and other things, because I think enough people have enough animals dying on the property from random events, I guess, non-nutritional events, that it would be pretty straightforward to get a sample of copper. Can't sample of liver, send it out to OSU to the diagnostic lab and we can get some measurements. And I think these things are going to be pretty important. So
Is that a liver biopsy?
yeah, that's the other thing. So if you want to do it on an animal, you have to do a whole liver biopsy.
I think OSU sends it to me somewhere else.
They might.
I think they
They
send
make
it,
it might go
because I
to-
just paid, I think, like $80.
Yeah,
on
it might go to
biopsy.
So the idea was, instead of doing all this and putting an animal through the stress of doing a liver biopsy, and which sometimes you have to use an ultrasound, you got to do all this, wait till something accidentally dies.
But there's usually signs, if they're, at least in goats, if they're copper deficient.
There can be, but the thing is that what we're finding though, and this is also going back to the parasite issue, with the goats and the supplementation of the copper oxide particles, which I know a lot of you, or certainly some of you have tried, and some of you have told me you feel it's really working well. One of the issues is what we don't know, are these wire particles, are they having a direct effect on the parasite, or is it because we're somehow...
Copper for parasites,
Yeah, so are we boosting the immune system through copper supplementation? We don't know. So, and the other thing is I don't know where these guys came up with this. The study that I read, they decided 15 or more animals needed to be tested if you actually want to get an accurate measurement for herd copper or zinc. I know a lot of you guys are going to have like 6, so I don't know.
We'll have a pool.
So with the copper supplementation that we're doing with the copper oxide, have there been any studies showing that we're giving too much copper? I mean, is that what you...
I don't know. Shelby? Has anybody been shown with the copper oxide particles of any kind of toxicity problems? I know it's a problem with sheep.
I'm not familiar with any data on
Yeah.
the copper particles,
So-
with how well they work and
One of the problems is that, as we know right now, one thing I do know is, as we know right now, is that they give these things and the blood levels and the liver levels are so variable that they're like, wait a minute, how the hell? I mean, right now, a lot of this is, the data is so inconsistent, we can't draw any conclusions from it. So again, we still don't even know how it works really. We know the theoretical.
It seems like too, 15 animals or more. It seems to me that within any given herd, I have Nigerians, I don't know if they're different from other goats. You might have one that, oh my God, he needs a copper bolus every 6 months. And I've got some that I never loose
Right.
marrows, that's what I get.
Exactly. And so again, we're also coming down to, the whole parasite resistance thing is a huge topic. And one of the things that we're going to have to go back to, because our dewormers are just not going to be that effective anymore, is that you're going to have to make hard decisions as producers as to who you breed. Because there will be animals that you have to give them copper bolus or deworm them every 6 months, otherwise they just crap out on you. Those aren't genetics you want to herd.
See, I don't think of copper as being,
No, well, I know.
The two with, there's way other issues with copper
But
and
this is where it's coming down to.
Yeah.
It used to be 100 years ago, if you had an animal that needed extra supplementation, needed extra medicine, needed this stuff all the time, you weren't going to keep it around the herd.
Yeah.
The ones that lambed, always gave you triplets, or at least twins, and everybody always survived. Those are the ones you picked. And then we come along 40 years ago, create medicines, dewormers, vaccines, and essentially what we've done is we've put it bluntly, we've allowed very bad genetics to propagate in commercial operations. And what's going to happen is, at some point is, and we can do all the maybe genetic testing will be the answer. Sometimes I think about, man, I wish I could go talk to some of those old like Portuguese farmers I knew in California, because they would just look at it and they would know, you know, that talent is lost already. It's pretty amazing, but genetics, we're swinging back. I mean, we really are. We're swinging back around. So, and we can talk for hours on this thing. It's fascinating, but the truth of the matter is again, we've allowed poor genetics to be propagated due to use of medicines, use of different things. I mean, hell, I'll take myself as an example. I have horrible grass allergies. Horrible. This is not the valley you want to be in. So, if I didn't have intranasal steroids, there's no way I could live here. Okay? I'd have to be in the band yard. You should have been called. So, I mean, and this is just kind of, you know, medicine. I mean, the use of medicines, the use of vaccines, the use of some of these things, it comes with a price. Sometimes we're a little cavalier about what we do, and in the long run, you know, we kind of go out and like I said, I told most of you guys, I mean, 10 years ago, I would have told you to your face, you are a bad owner if you're not deworming every 8 weeks. 10 years later, I'm like, oh, I'm sorry, I didn't mean that. I need you to bring me a fecal sample. So, anyway, okay, so here's another one. This is also the use of Valvazin in pregnant sheep. Valvazin, as some of you may or may not know, is albendazole. Okay, the dewormer is albendazole. Very similar structure to fenbendazole, which is the Panacure and your safeguard. The thing about Valvazin, it also has chlorshulon in it, which is good for flukes. And you know, whether you use flukes or not, you have flukes or not, it actually is now one of the few commercial sources of chlorshulon because it, again, pulled a lot of this stuff off the market. And we may end up having to use more Valvazin just because, again, of the resistance issues. But one of the things on is, if you look on a bottle of Valvazin, it says on there, do not use during the first 45 days of pregnancy, otherwise it will cause birth defects. And in reality, that information came, if I remember correctly, because one farmer in Idaho called and bitched out the company because after he gave it to his cows, he had a bunch of problems. That's literally where it came from. So, studies are now actually being done. And what they did is the sheep, this was done at 1.5 times the therapeutic dose. And it did show that if you gave it at day 17, lower pregnancy rates and birth defects were noted. They don't know why, but it wasn't. Given at days 30 and 45 had no effect, and this given to rams had absolutely no issue with sperm quality. So at this point, would basically recommend, if you're going to use Valvazin, which I love Valvazin, I really do, I think it's a wonderful product, do not give it to pregnant animals before, say, 45 days. So I would just say follow the label dose, you're going to be fine.
What about lactating animals?
We don't know. Again, this is what I'm saying. This is a product that's been on the market for a long time, and we actually have little information on it. So I think the label on it says don't give it, or at least it hasn't been studied. Because you got to remember, when a lot of these things hit the market, they're very targeted.
Yeah.
So they don't have to do the studies on it. Okay.
But you're a very narrow window if you got a drug that's milking 305 days.
Yes, I understand. Here's something else. Long-range deworming. This is again going back to the resistance issues. As many of you know, one of the reasons why we don't like, as veterinarians, we don't like injectable wormers is because the easiest way to develop resistance in any animal or any parasite, bacteria, or anything is to expose that organism to what we call a sublethal dose of a drug. If you just expose it, say a 2% solution, a concentration of a drug kills it, and you expose this thing to a 1% concentration, not only will it not kill it, it'll rapidly develop resistance to it. So what this is, what long range is, it's an injectable ivermectin, which is part of the avermectins, the ivermectin family. This is Epernex, for those of you who may have seen it on the shelf. Okay. The way it works is it's this, they call it matrix formation. You inject this thing, and it's only studied in cows, it's only got a label for cows, but then of course as soon as something comes out for cows, all of us small ruminant producers and veterinarians go, ooh, hey, can we use it? So what happens is you give this thing sub-Q, and it forms literally this gel underneath the skin. It's called this matrix formation. So what it does though is, for the first 25 days, it's like sky-high concentrations in the tissue, and then it drops off slowly. And the idea though is that it will stay above the therapeutic dose. So it's actually going to stay above at the killing dose for the next almost 2.5 months, 2 months. At approximately day 75, it spikes again because of the way this thing dissolves. And it holds on for high concentrations again for another 25 days. So you get somewhere around 125 days of high killing dose of an ivermectin product, which obviously the idea would be, oh my God, 4 months worth, almost 5 months worth, you get one shot and you're getting 5 months of kills. I mean, think about it, it's almost lambs. You inject them all the way up right until slaughter. It's pretty awesome. The problem is that small ruminants, sheep and goats, tend to metabolize drugs at a much faster rate. And we don't know the information right now. The extrapolating from other drugs into small ruminants, we basically think that your sky-high concentration won't be sky-high, that 25-day window will shorten. When it does fall down, it's actually going to go down below the therapeutic dose and stay there for 6 to 2 months, and then pop back up again. It'll do the same thing, but the peaks will be lower, and so will the trough. So as a result, what a lot of people feel is this use of this in small ruminants will be the death knell for ivermectin. People start using this. Ray Kaplan, who works out of the University of Georgia, Small Ruminant Consortium, he wrote that he believes that if you have a flock with even moderate resistance in your parasites, you use this in one season within 120 to 150 days after treatment, most of your parasites on your pasture will be resistant. So you may see this. You may be tempted to use it. I would recommend you do not. Okay, so for those of you who milk goats, EBV, which is the estimated breeding value, okay, EBVs are, again, one of these genetic things I really don't understand. It is the measurement of the heritability of a trait. So you take something that's genetic, can be passed along, they slug it into this formula, and it comes out with a number, which will then tell you, based on this trait, this is the likelihood of them passing this trait along is X number. Now, so we know that, they can figure that out. The other thing that we do know is somatic cell count is heritable. Animals that have, like a doe that would have a high somatic cell count, which is the number of white cells in the milk, her offspring, for the does that she produces, will also have high somatic cell counts. And we also know that high somatic cell counts are directly correlated with intramammary infection and therefore mastitis. So what they tried to figure out was the relationship between EBV, somatic cell count, and mastitis and dairy babies. Basically what it was that it was true. All it said was that if you breed the EBV, the estimated breeding value based on somatic cell counts, if you're breeding goats with high somatic cell counts, you will have a higher incidence with mastitis in your offspring. Whereas if you breed them with low somatic cell counts, you have a lower incidence. So again, one of those genetic tests or something like it that may be able to alter your breeding program. And then the last thing, which I thought was really interesting, a group of veterinarians in China developed a DNA vaccine against Haemophilus. Haemophilus contortus is the most feared parasite that small ruminants that we deal with. And they were able to develop a DNA vaccine. And what they found was 35 to 37% drop in fetal egg counts, as well as an increased number of eosinophils, which are eosinophils of the white blood cells that are recruited to fight parasites. So this one was weird. I saw this and I actually got excited, so I thought that would be kind of cool, vaccinating against parasites. Vaccinations against anything other than viruses is iffy at best. When we vaccinate against bacteria, we get a lot of site reactions and incomplete protection. Vaccinating against viruses, things tend to work pretty well. Vaccinating against parasites on average doesn't work very well. So these numbers are actually quite high. So, who knows, hopefully we'll see something like this coming down the pipe, because the truth is, again, parasite resistance is a huge problem. So, anyway, I have spent way too much time. So, I'd like to take questions, but we're running late. So I'm going to bring Shelby up.